Marley Drug.
Hi, my name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. Today we're going to cover a medication called Cimetidine, commonly known by its brand name Tagamet, which was first approved by the FDA in 1977, so it has been on the market for over 4 decades. Cimetidine is part of a drug class of medications known as histamine H2 receptor antagonist, or H2RA for short, and is available with a prescription as well as over the counter for heartburn only. Initially, it was primarily prescribed to treat ulcers and other gastrointestinal conditions. However, its use has expanded over the years to include other conditions such as heartburn and acid reflux. Let's discuss how Cimetidine works as well as the different conditions it can be prescribed for. Cimetidine works by reducing the amount of acid produced in your stomach. It does this by blocking a certain type of receptor called histamine 2 receptors, which are involved in acid production. As mentioned, over-the-counter Cimetidine can only be used for heartburn for milder symptoms. However, doctors generally prescribe Cimetidine for more severe cases of these conditions, such as erosive gastroesophageal reflux disease, also known as GERD. This condition happens when stomach acid frequently flows back into your esophagus, causing irritation and symptoms such as heartburn, gastric and duodenal ulcers, which are sores that develop on the lining of your stomach, while duodenal ulcers occur in the upper part of your small intestine, also known as a duodenum, as well as Zollinger-Ellison syndrome, which is a rare digestive disorder that results in too much gastric acid. Cimetidine is available as an oral solution as well as in tablet form. For the Cimetidine oral solution, store it at room temperature and use the medication dose cup or oral syringe provided by the pharmacy to measure the dose accurately. Avoid using kitchen spoons as they may not provide the correct dosage. The over-the-counter strength is 200 milligrams. You can take over-the-counter Cimetidine once daily to alleviate heartburn associated with indigestion. To prevent heartburn, take this medication either just before or up to 30 minutes before eating or drinking, which triggers heartburn. Swallow the tablet whole with a glass of water. Keep in mind that it is recommended to take over-the-counter Cimetidine for a maximum of 14 days. If you need to take it for longer than 14 days, discontinue use and consult with your healthcare provider. They can suggest a different medication that may be more appropriate. The prescription strengths include 200 milligrams, 300 milligrams, 400 milligrams, and 800 milligrams. When taking prescription Cimetidine, it is important to swallow the tablet whole and avoid crushing or chewing them. If you're having difficulty swallowing the tablet, consider asking your provider about switching to the oral solution. Cimetidine can often be taken in 2 ways, either as a larger dose once a day or as a smaller dose several times throughout the day, depending on the condition being treated. If you're taking Cimetidine once daily, it's best to take it at bedtime. If you're taking it multiple times a day, take the medication with meals and at bedtime. If you do forget to take a dose, take it as soon as you remember. However, if it's almost time for your next scheduled dose, it's best to skip the missed dose and continue with your regular dosing schedule. It is, however, important to avoid doubling doses to make up for the missed one. And like all medications, Cimetidine has a few side effects. Some common side effects may include diarrhea, dizziness, fatigue, sleepiness, headache, or breast enlargement in males, which is more likely with long-term use. If you are experiencing any of these side effects, be sure to talk with your healthcare provider to determine whether a dose adjustment or switching to a different medication would be beneficial for you. Cimetidine may also cause some serious side effects in some. Some serious side effects of this medication that you should be aware of include signs of liver problems such as persistent nausea or vomiting, severe stomach or abdominal pain, yellowing of the eyes or skin, and dark urine. Or mood changes including agitation, confusion, depression, or hallucinations. Or severe stomach or abdominal pain, severe headache, persistent sore throat or fever, or allergic reactions such as rash, itching, swelling of the face, tongue, or throat, dizziness, or trouble breathing. If you are experiencing any of these serious side effects, immediately call your doctor and stop taking this medication. Keep in mind that Cimetidine may interact with certain medications or supplements. So always inform your doctor and pharmacist about any other medications or supplements, including prescribed and over-the-counter vitamins and dietary or herbal supplements that you are currently taking. It is recommended to avoid using cimetidine with medications that could increase your risk of certain side effects, such as ketoconazole. Cimetidine can also prevent other medications from working as well and increase your risk of side effects. These medications include warfarin, propranolol, and amitriptyline. To briefly summarize what we discussed today, cimetidine, known as Tagamet, gained FDA approval in 1977 and has been on the market for over 4 decades. It belongs to the histamine H2 receptor antagonist class and is available both with a prescription and over-the-counter for heartburn. Cimetidine works by reducing stomach acid through histamine 2 receptor blocking. Over-the-counter cimetidine treats mild heartburn, while prescriptions are generally used for severe conditions such as erosive GERD, gastric and duodenal ulcers, and Zollinger-Ellison syndrome. It is available in various strengths and forms such as oral solutions and tablets with specific dosing instructions. Cimetidine may interact with other medications, affecting their efficacy and potentially causing side effects, emphasizing the importance of disclosing all current medications to healthcare providers. You can read more about GERD or Zollinger-Ellison syndrome on our website, so check those articles out in the links below. If you have any questions about cimetidine, be sure to ask your doctor or leave them in the comments below. And don't forget to subscribe. Bye for now!